everyone. Welcome to today's press conference to announce the launch of the Bermuda Health Strategy 2022-2027. The Minister of Health, the Honorable Kim Wilson, JP, MP, is joined today by the Ministry of Health's Chief Strategy Officer, Ms. Adine Rattery-Price. Minister, you can begin with your remarks. Thank you.
Thank you, honey. Good day, media and members of the public. Today, we are here to announce the launch of the Bermuda Health Strategy 2022-2027, a 5-year strategic plan for strengthening the island's health system and improving our health outcomes. You may recall our previous health strategy, which outlined Bermuda's path forward between the years of 2014 and 2019. However, it was due to be updated just before the global pandemic hit in 2020. COVID-19 presented the healthcare system here and around the world with unexpected and unprecedented challenges. For us in Bermuda, it further highlighted some of the strengths and weaknesses of our healthcare system and forced us to pause and rethink some of our goals and priorities. Today, we are excited to share our refreshed strategy with you as we progress towards the Ministry of Health's vision of healthy people in healthy communities. Prepared with the assistance of KPMG's global health experts, the Bermuda Health Strategy 2022-2027 is a product of meetings with the ministry and includes input received from the strategic leadership group that was established prior to the pandemic, as well as the dedicated and diverse group of stakeholders who make up the Universal Health Coverage Steering Committee. One of the highlights of the strategy is its focus on the need for greater collaboration among healthcare industry stakeholders. We are building stronger partnerships so that together we can find solutions to the health challenges the island is facing, while also ensuring more efficient use of healthcare system resources. The strategy also outlines a shift to a more people-centered approach to healthcare with the aim of delivering essential care that meets the needs of individuals and families today and for many years to come. It aims to bring about health system reforms that enable people to feel more included in the decision-making process around their health and wellness, as well as improving the patient and family experiences as a whole. Furthermore, the Bermuda Health Strategy 2022-27 prioritizes the promotion of healthy living and preventative care. We know that health promotion and disease prevention are essential ingredients to building a stronger health system, and we will be joining forces with other healthcare and community stakeholders to ensure this message is amplified and reaches all segments of our Bermuda population. Many of the chronic illnesses that are impacting our community and placing a large burden on our healthcare resources are strongly related to lifestyle factors, including poor diet, physical inactivity, and smoking. We in the ministry understand that more must be done to empower and support people to lead healthy lifestyles, and we are identifying ways to provide greater tools and resources to the public. Through public policy and other measures, our aim is to make it easier for people to shift their mindsets and behaviors towards making healthy choices. In total, the updated health strategy outlines 8 core areas that must be at the forefront of our minds as we seek to strengthen Bermuda's healthcare system. And they are as follows: promoting healthy living and preventative care, focusing on people-centered care, understanding our population's health needs, providing universal access to healthcare coverage, strengthening our healthcare workforce, harnessing healthcare technology, partnerships and collaborative working, and preventing wasteful care and promoting efficiencies. You may be asking why the need to strengthen Bermuda's healthcare system and why now? The fact remains that in its current state, Bermuda's healthcare system is unsustainable. In addition to the high costs, which continue to grow year on year, the health of our people is also struggling in many respects. According to the statistics gathered pre-pandemic, 50% of Bermuda's residents have at least one chronic condition, such as diabetes, heart, or kidney disease, while 75% of our population is either overweight or obese. Additionally, 1/3 of our residents have either high blood pressure or high cholesterol. In terms of cost, $29 million is spent annually on dialysis alone, and the demand for this service grows by 10% each year. Bermuda spends 11.55% of our GDP on health, which is the third largest in the OECD. The island's health expenditure grew 92% between 2006 and 2017, and if nothing is done now, it is forecast to grow a further 43% in the next 2 decades. We understand that the positive changes we need to achieve will not happen overnight. Bermuda's health system challenges are complex and will require collaboration between all stakeholders to see the people-centered, multi-year change required for a more sustainable future. The Bermuda Health Strategy 2022-27 continues and refreshes government's commitment to a healthy Bermuda. The necessary health system strengthening is incremental, however, and will take place over a long term, initially a period of 3 to 5 years. This is not a big bang version of transformational change. The strategic principles embodied in the health system provide a framework to address what are admittingly challenges of longstanding that have been identified by stakeholders and the public. Included in the strategy is one of the government's ambitions to ensure that all people have equitable access to essential, affordable health services through the universal health coverage. As it stands, up to 35% of the population remains unable to access quality health care without financial hardship. And this includes those that are uninsured, which is about 12% of Bermuda's population, as well as those that have defined unaffordable health insurance or are underinsured, which accounts for approximately 23% of the population. Providing universal health coverage for an essential benefits package for all residents is not something important that's only to Bermuda. In fact, the World Health Organization has challenged countries around the globe to look at healthcare as a basic human right, which is why many countries around the world have already begun the journey to adopting universal health coverage. Although each country has taken a different path to achieving this goal, we in Bermuda must decide for ourselves, with the help of all of our stakeholder groups, what essential care health services we will cover based on the current and future needs of our people, as well as the resources that are available. We look forward to working with all healthcare stakeholders, including our local doctors, nurses, insurers, and our businesses, our union, and our community partners to make the necessary changes to better Bermuda's healthcare system. And I'm grateful for the work that has been done to date to develop the Bermuda Health Strategy 2022-27. And I'm very optimistic about our path forward to creating a healthy Bermuda community. Thank you.
Thank you, Minister. We will now take questions from the media, starting with Jasmine Patterson of the Bermuda Broadcasting Company. Welcome, Jasmine.
Thanks, honey.
Go ahead, Jasmine, you can start.
Good afternoon, Minister. Thank you for that presentation. So 3 to 5 year strategic plan, it's quite a lot to be done by the sounds of it. But how long do you anticipate before individuals could see healthcare costs come down? Is there any chance of that happening before that time frame?
Thank you for that question, Jasmine. I know it does sound like 3 to 5 years sounds like a long period of time. Regrettably, we have to recognize it's taken us decades to get to the position that we are in with respect to the cost of our healthcare services, and in particular, as it relates to the wellness or lack thereof of our general population. When we look at how much we spend on healthcare in Bermuda, approximately 11.55% of our GDP is spent on healthcare. And that's very, very exorbitant costs that we're spending for poor outcomes. So we need to look at 2 things. One is the sustainability, and 2 is how we can ensure that we have preventative measures in place and that we take steps to have a better health outcomes for our population. When we look at healthcare costs, it's system costs. So when we see a reduction in the system's costs, that obviously trickles down to you and I as individuals as well. So looking at system costs and reductions of costs doesn't mean just looking at what the amount is that you spend every month on a premium. But when we look at wider system changes and system costs, we have to reduce the costs that we're spending on healthcare. Again, 11.55% of GDP is an enormous amount, and we need to address that from a bigger perspective.
Under a new healthcare system, do you anticipate specialists, charities that deal with certain health conditions, do you expect them to be phased out, or will they be included under a new healthcare system?
Under a new healthcare system, there's two ways I want to answer that. One is that we will be starting work streams, and we will be asking for members of the public, insurers, the medical community, patient representatives, et cetera, to be part of this planning, because we are in the infancy stages of the planning, and we need to have a collaborative approach so that we can find what works best for Bermuda. But in addition to this, whatever health plan is created, it will obviously have to look at what is essential so that we can meet the needs of individuals that are the essential needs. But there will always be additional services that are potentially required. Likewise, there'll always be a need for supplemental insurance to cover those particular additional services. But what we are looking at in conjunction with what the World Health Organization has defined as universal health coverage is providing the essential packets to those residents at a cost that will not break the bank.
And in terms of essential services, are you able to indicate what that could include?
At this point, no. That's the work that has to be done. And that's why we're launching this health strategy. And we will be encouraging members of the public to help to participate. When you see it launched today, there'll be information, and there's FAQs as well as a link to say, this is what I'd like to do. This is how I'd like to volunteer and participate in this collaborative approach. So it's far too early at this point to say what those essential services will look like. We have to look at it strategically. We have to look at what our healthcare needs are in Bermuda, and part of that discussion will take place with the stakeholders.
Yeah, if I can just add to that, Jasmine, an important part of starting this work is actually a needs assessment, a health needs assessment of the population. And that's when you're able to identify what those high priority needs are, and that can then translate into what those essential benefits package ends up being.
Thank you. And how would you describe the participation when it comes from insurance companies? Are they quite happy to participate?
We've had participation from a cross-section of stakeholders, and the insurance companies are obviously a critical element and key to this whole process. So they have been heavily engaged, and we will continue our collaborative efforts with them, as well as our union partners, our patient representatives, our physicians, and our medical community. Again, this is for Bermuda, and it will require participation from a broad perspective of all of our stakeholders for us to ensure that we design something that is Bermuda-centric and that works for our Bermuda population and our special needs here.
Thank you.
Thank you.
Thank you, Jasmine. We'll now have questions from Fiona McWhirter of the Royal Gazette. Fiona?
Good afternoon. Thank you very much for the information this afternoon, Minister. Greatly appreciated, and thanks for having us. Can you tell us, I think you mentioned that about 30% of the population is estimated to be either or underinsured. If they are in a position whereby they're unable to access some of these essential services now, how will that change under the new model?
Well, under the new model, when we're looking at the services or a policy, so to speak, that will be made available for all members of the public, it will be certainly factors that will come into play will be what is essential, which we spoke about as well as cost factors. I think when you look at, we need to also look at system-wide getting efficiencies within the whole system, because as you've heard me speak about how much money we are spending on healthcare within our population. So when we're able to, in essence, control cost in this level, that will allow us to filter down to control costs in another way, or to provide that cost savings onto the policyholders. So it is a huge aspect that we have to look at, but at the end of the day, we will be able to provide economies of scale. One of the things that you would have heard us speak about in the throne speech was to combine administratively the government policies, which will create, like I said, economies of scale and more bargaining power, because we'll have more persons that are actually enrolled in those government schemes, where we can then go out to industry and say, how much will it cost for ABC benefits and services, because we've got more persons in that. So all of those are factors that need to be considered. And again, more will be heard, and I'm inviting everybody to read the strategy, because you'll see what our 8 objectives are, what questions need to be answered so that we can move this forward, as well as inviting members of the public to participate in this process.
If I can add to that, one of the things that an essential benefits package would likely take into consideration is certainly your primary care situation. If someone does not have insurance now, then they may be using the hospital's emergency department as their primary care provider. And that's the most expensive way to receive a health service, is through your emergency department. So all of those things need to be factored in as we consider what the essential package will be, as the Minister said.
If there are individuals, though, who can't afford that essential package, is there some way that they will be provided for, or will there be some people that don't need to pay anything for some of those essential items? And if that's the case, are we going to have to raise taxes to get there?
Oh, I think we may be missing the meaning of the term universal. The intention for the essential benefits package is to cover universally everyone for those essential health benefits.
So if there are some people who can't afford that, they would still be covered. Is that what you're saying?
There will have to be a mechanism for that, and that's part of the planning that we need to do. We are quite a ways away from that right now.
So we can't say at the moment whether or not that would be a tax increase somewhere?
Oh, heavens no. If you look at the description that the Minister provided in the House of Assembly after the throne speech, you will know that there are somewhere in the region of 8 or 9 steps to get through before we know what the financing will be. So we are a long way from knowing the answers to those sorts of questions. It is frustrating, as the Minister points out, it is frustrating for people to hear us say that we are not yet in a position to answer the question. But the reality is the government has decided to take a deliberate and comprehensive approach to strengthening our healthcare system. And that requires more research, investigation, and collaboration with our stakeholders in order to bring the plan to fruition. So it would be premature to speculate.
Thank you very much. Minister, we have heard you continue to talk about a single payer, or sometimes I think you've used the phrase a dominant payer model. That was something that was criticised by certain sectors of the community a couple of years ago when we were having these discussions before. Why has the government continued with that model?
Well, that model is just a mechanism for the payment of this particular health plan. And when we had quite a detailed consultation, as well as town hall meetings, consultation, stakeholder engagements that are up and down the country for several months to get to that particular position, the government has committed to that as the mechanism with respect to financing this health plan. But as Ms. Ratterbury-Price just indicated, we're so far away from that particular aspect, or even further discussions on that. At this point, we need to basically reshift and look at what the plan will include, what are the needs of our community insofar as essential services and so forth. But that was work that was engaged in, as you rightly said, in 2018 and 2019, following extensive consultation, extensive discussions and the like. However, we are now re-engaged following the pandemic and looking at what is going to be, not so much how the plan will be paid for, but what will be in the plan and what will be the essential services and benefits that are all patient-centered, putting the patient and their family at the center of whatever these essential packages are going to be included.
But are we right in saying that it's still the case that a single payer model is the one that will be used?
That's correct.
Yes.
Thank you very much.
Yes.
You've talked a little about promotion of preventative healthcare. I guess keeping people healthy before they're at the point that they need a doctor or a hospital. Can you give us a little bit of an indication about how any funds from the sugar tax has helped with that?
The funds from the sugar tax would have gone into the consolidated fund, and part of that fund obviously goes to health, and we are able to utilize that for such things as our health promotion office, which you may see them every now and again. They're dancing up and down the streets or doing things at City Hall and as well as Victoria Park to have like workshops and public engagements that are fun, as well as promoting healthy lifestyles and healthy living. So part of that would have gone obviously to the continuation of the services under our that part of the department.
Sure. So has it made a difference then? Have we become healthier as a result?
Well, the last omnibus survey that was done, I don't have the year, but it would have been just prior to the pandemic, showed a reduction in the consumption of sugary drinks by adults. So obviously that's something that's certainly a positive impact. As I stated already, we spend $29 million a year on dialysis with an increase of 10% a year. So clearly we have to address that. And part of that, unfortunately, does relate to poor diet and the consumption of sugary items.
Yes, it is a fact. It took us years to get to where we are, and it'll take us a considerable period of time to undo what we've done. But a huge part of that is health promotion and prevention of care so that you don't need a doctor.
Thank you.
Preventative care.
And with regard, I think we touched on how is the strategy looking ahead for the next 5 years going to touch on and work towards addressing overutilization of things like tests and treatment?
When you have an opportunity to look at the strategy, there are, like I said, 8 core points. And one of the points, item number 8, actually relates specifically to preventing wasteful care and promoting efficiency. So it will look at how to make it a more efficient system, and that includes looking at overutilization. So that will be point 8, and you'll be able to see that on the strategy. So it speaks to maximizing efficiency in addition to improving the health outcomes. So it will look at things like overutilization.
Sure, but how can we do that in practice?
What you would do in practice is really set benchmarks and standards. And once you do that, then everyone knows, patients and providers alike, what the standard is that should be being followed.
Thank you very much. And just with regards to, we've noted that KPMG has been involved in this work. Can you tell us what has been paid to them so far and what the budget is for their participation as we go forward?
I would have to come back to you with that information. I believe the consulting budget, which includes things other than just KPMG, in the next budget year is $750,000. I believe that's the number. You had asked about that before.
Thank you. And that's to look ahead at the health strategy and the work towards universal health coverage. Is that correct?
Yes, that was what we put in for the upcoming fiscal year.
Understood. I appreciate it. Thank you both very much.
Thank you, Fiona. And our next set of questions will be from Media Maya.
Good afternoon, everyone.
Hello.
My first question, I believe will go to the Minister of Health. How will universal health coverage affect businesses and their health insurance policies for their employees in Bermuda?
Again, these questions are very, very important questions. However, as I indicated, we are just starting the process. We have unfortunately had a break for almost 2 years because of COVID. So we've just part of us getting towards taking steps towards universal health care was first and foremost for us to have a health strategy so that we could look at on a regular basis our health system and determine what is working well, what's not working so well, and how we can address that. However, as part of the package, when we look at the Bermuda Health Plan for a package, again, it will be based on essential services and essential benefits that are required for individuals. And the plan at the time that was announced previously when we were dealing with health financing reform, and it still remains the government's commitment, is to ensure that whatever those basic essential elements are of the package are at an affordable price so that it doesn't adversely impact businesses and or individuals who wish to avail themselves to the plan. But it's far too early for us to say, A, how much that plan will cost, and B, what will it include? As you can appreciate, the more benefits that are offered, the higher a policy cost.
And,
Okay, understood.
And the efficiencies we're trying to achieve are system-wide. And so those will take some time to filter down to your actual premium payment.
All right. Thank you very much for that clarification. My next question, because I do recall before the pandemic when you guys did have some town hall meetings, I recall one in St. George's that I actually attended to learn about the universal health coverage, where there were many medical professionals actually there in attendance and seniors, because that seemed to be the biggest concern for them when it came to the universal health coverage. So what has the participation been like, or the support from doctors been like in, the talks about universal health coverage? Have they been positive? Have they been involved in any way, and what does that look like?
Well, as you said, prior to 2019, we did hold several public surveys, public interviews with providers, insurers, professionals, as well as patients. However, subsequent to that, we have a steering committee that has been made up of members of the medical profession through the Bermuda Medical Doctors Association, Bermuda First, insurers, as well.
It's HID rather than the insurers.
The Health Insurance Department, as well as the Bermuda Hospital Board, Bermuda Health Council, and
Department of Health and patient representatives.
So all of them together represent the UHC steering committee, who are collectively working towards our objectives of the 8 core Bermuda Health Strategy that we just announced.
It is the reception so far, and we have, as the minister stated in her statement after the throne speech last year, we have been engaged in outreach to stakeholders. So not just the groups that are represented on the steering committee, but also ABER, ABIC, BILTER, the Chamber of Commerce, Bermuda Employers Council, the Bermuda Business Development Agency, the Bermuda Hotel Association, our union partners through the Bermuda Trades Union Congress, the ministry itself, all the staff of the ministry, the allied professions such as dentistry, physiotherapists, so on and so forth, the Nursing and Midwifery Council. So we've done a lot of presentations to them regarding more the technical approach to achieving universal health coverage, which the steering committee was largely responsible for developing. And we will continue that. It is a challenging topic, as you keep hearing us say in this conference right now, but the reality is we need to change. I don't believe that staying where we are is really a viable option, but looking at the value and cost of staying where we are is something that is part of the process as you evaluate going forward, particularly on the financial steps. And we hope and believe that we will reach a consensus on how best to move forward for Bermuda. It is challenging to the extent that Is there an expectation that everybody will agree with the ministry all the time on every point? Unlikely. Human beings don't work that way. But it is important to ensure that all the viewpoints are brought to the table, because the expertise in this does not just lie within the ministry, and it does not just lie on the steering committee.
Thank you very much. Just to reiterate, from all those conversations that you have had and speaking to all those professionals that you have there been, like, let's say, over 50% people are on board and understand that this is a step that needed to be taken, or is there more majority who disagree?
I haven't been measuring it that way, but I would say that everyone agrees that we need to make change, and everyone is positive regarding the government's commitment to collaboration in the process.
Thank you very much. My next question would be actually for people who are viewing, but from you, Minister, is where can people actually go online to find the health strategy package? Is it already uploaded, or is it going to be uploaded after this meeting? And if possible, could you tell us now what the 8 or 9 steps are that are included in the strategy that you mentioned?
Okay, I can tell you the 8 or 9 steps. I can repeat those, but it'll be actually live next week. So there'll be more information, and the link and the details will be made available in the coming days, but it will go live next week, Maya.
Yeah.
And again,
the strategy will be on gov.bm this afternoon, but the website devoted to the topic will be live next week.
okay, thanks. The 8 core areas, Maya, are promoting healthy living and preventative care, focusing on people-centered care, understanding our population's health needs, providing universal access to healthcare coverage, strengthening our healthcare workforce, harnessing healthcare technology, partnerships and collaborative working, and preventing wasteful care and promoting efficiency. So again, Maya, this is a copy of the strategy, and it'll be on live today.
Thank you very much.
You're
And
welcome.
my final question, actually, the stats that you gave in this press conference, the 50% of the island have chronic conditions, 70% are obese. Can you tell me what year those stats were taken from?
I believe those are all pre-pandemic stats.
Yes.
So one of the first and highlighted items as part of this is assessing the health needs of Bermuda today. Do I expect to see that we are healthier after 2 years of pandemic? I hope so, but I'm not entirely convinced that will be the case.
All right. Well, thank you very much. Those are my questions.
Thank you, Maya.
Thank you, Maya, and thank you, Minister and Chief Strategy Officer. Before we close, are there any closing remarks that you'd like to give before we finish?
Just thanks to the press for their questions and their participation. And again, I'm inviting everyone to have a look at the Bermuda Health Strategy 2022-2027. And as we've stated previously, as we move forward to the common goal of strengthening our health system, as well as providing services, essential services for individuals to ensure as best as possible that persons can maintain a healthier lifestyle, we will be encouraging further collaboration and engagement, because we recognize that this is something that has to be Bermuda-centric, and we will require the participation and the input and continued collaboration with all of our stakeholder partners so that we can continue to build on the strengths that currently exist within our healthcare system, but also make provision for the provision of essential services for individuals, as well as a health system that's more sustainable. Thank you, honey.
Thank you, Minister, and thank you to members of the media. That concludes today's press conference.